Right now, as you're watching this video, there's a 1 in 10 chance you'll develop kidney stones in your lifetime. And here's what's terrifying. Most people ignore the early warning signs until they're writhing in agony on a hospital floor, begging for relief from what many describe as worse than childbirth. Stay with me because by the end of this video, you'll know exactly what to watch for, and I'm going to share something that could save you from the most excruciating pain you'll ever experience. Kidney stones affect over 600,000 Americans every year, yet there's a massive disconnect between what people think they know about kidney stones and the reality of this condition. The medical industry wants you to believe it's just bad luck, genetics, and unfortunate circumstances. But here's the truth they don't want you to know. Your lifestyle choices are loading the gun, and ignoring these 7 critical symptoms is what pulls the trigger. Let me paint you a picture of what really happens inside your body when kidney stones form. Imagine tiny crystals slowly building up in your kidneys like sediment in an old pipe. At first, they're microscopic, completely silent, giving you no warning whatsoever. This is why kidney stones are called the silent destroyer. They can grow for months, even years, without a single symptom. You're going about your daily life, completely unaware that your body is building what will eventually become your personal torture device. But here's where it gets interesting, and this is crucial information that could change everything for you. The moment these stones start to move, your body begins sending you distress signals. The problem? Most people mistake these early warnings for something else entirely. Before we dive into these 7 critical symptoms, make sure you subscribe and hit that notification bell, because what I'm about to share with you could literally save your life, and I don't want you to miss any of our life-saving health content. Symptom number 1. The phantom back pain that comes and goes. This isn't your typical muscle ache from sleeping wrong. We're talking about a deep, gnawing pain that starts in your lower back and seems to pulse with your heartbeat. It might disappear for hours or even days, making you think it was nothing serious. Here's what's actually happening. As the stone shifts position in your kidney, it's scraping against delicate tissue, causing inflammation that creates this mysterious back pain. The reason it comes and goes? The stone is still small enough to settle into comfortable positions for now. Symptom number 2. Urination changes that seem harmless but aren't. You might notice you're going to the bathroom more frequently, but each time it's just a small amount. Or maybe you feel like you constantly need to go, but when you try, barely anything comes out. Some people experience a burning sensation that they dismiss as a minor infection. This is your kidney desperately trying to flush out the obstruction. Your body knows something's wrong, and it's working overtime to fix the problem. Ignoring this symptom is like ignoring your car's check engine light. It might run fine for a while, but disaster is coming. Symptom number 3. The color change no one talks about. Your urine might appear darker than usual, sometimes with a pink or reddish tint. Most people notice this and think, I'll drink more water tomorrow. But here's what's really happening. Those stones are causing microscopic bleeding as they scrape against your urinary tract. Even if you can't see blood with the naked eye, laboratory tests would reveal red blood cells in your urine. This invisible bleeding is your body's cry for help, and it's happening right now in thousands of people who have no idea they're in the early stages of kidney stone formation. Now here's where things get serious, and this is information that could save you from ending up in the emergency room. Symptom number 4. Nausea that doesn't make sense. You're not sick, you didn't eat anything bad, but you feel queasy for no apparent reason. This might happen in waves, especially when that mysterious back pain flares up. Most people reach for antacids or assume it's stress. But here's the connection. Your kidneys and digestive system share nerve pathways. When kidney stones cause irritation, those nerve signals get crossed, creating nausea and even vomiting. Your body is literally trying to tell you something is seriously wrong. Symptom number 5. Sudden, intense episodes that make you stop everything. Picture this. You're going about your normal day when suddenly, out of nowhere, pain hits you like a freight train. It's so intense you can't stand up straight, can't find a comfortable position, can't think about anything else. Then, just as suddenly as it came, it disappears. You might think, that was weird, and continue with your day. But what just happened was your kidney stone moving from one position to another, temporarily blocking the flow of urine before settling again. These episodes are your final warning. The stone is getting ready to make its journey, and when it does, you'll understand why kidney stone pain is compared to childbirth. Symptom number 6. The fever connection that doctors don't explain. Sometimes, along with these other symptoms, you might develop a low-grade fever. Most people assume they're fighting off a cold or flu and don't make the connection to their other symptoms. But here's what's actually happening. When kidney stones block urine flow, bacteria can build up, leading to infection. That fever isn't just a coincidence. It's a red flag that your condition is becoming more serious and potentially dangerous. Symptom number 7. Extreme fatigue that doesn't improve with rest. You're getting enough sleep, but you feel exhausted all the time. Your energy levels have dropped, and you can't figure out why. Most people blame work stress or getting older. The reality? Your kidneys are working overtime trying to deal with the obstruction. When your kidneys can't function properly, toxins build up in your blood, making you feel tired and sluggish. Your body is literally being poisoned by waste products that should be filtered out. Now here's what makes this entire situation even more concerning, and this might shock you. The industries built around treating kidney stones want you to wait until you're in crisis mode. There's more money in emergency treatments, surgical procedures, and managing complications than there is in prevention. But here's the truth. Most kidney stones are completely preventable through lifestyle changes that the medical establishment barely mentions. Studies show that simple dietary modifications can reduce your risk by up to 50%. We're talking about increasing water intake, reducing sodium, limiting certain foods, and adding specific nutrients to your diet. Foods rich in citrates, like lemons and limes, can actually prevent stone formation. Magnesium supplements have been shown to reduce recurrence rates dramatically. Even something as simple as drinking the right amount of water at the right times can make the difference between developing stones and never having to worry about them. But here's what really frustrates me about this whole situation. By the time most people learn about kidney stones, they're already in the emergency room, experiencing the worst pain of their lives. The stone has grown large enough to block their ureter completely. They're vomiting from pain, can't urinate properly, and need immediate medical intervention. What could have been prevented with simple lifestyle changes now requires expensive procedures, potential surgery, and weeks of recovery. If you're experiencing any combination of these 7 symptoms, the phantom back pain, urination changes, color changes in urine, unexplained nausea, sudden intense episodes, fever, or extreme fatigue, don't wait. The earlier you catch kidney stone formation, the easier it is to address naturally. Once that stone decides to move, you're at the mercy of physics and anatomy, and trust me, neither of those care about your schedule or pain tolerance. Your kidneys filter over 50 gallons of blood every single day. They're working 24/7 to keep you alive and healthy. When they start sending you warning signals through these symptoms, they're literally crying out for help. The question is, are you going to listen, or are you going to wait until you're on the floor of an emergency room, learning the hard way what kidney stone pain really feels like? If this video opened your eyes to symptoms you've been ignoring, give it a thumbs up and share it with someone who needs to see this information. Your share could literally save someone from unnecessary agony. And speaking of silent symptoms, there's something even deadlier, hiding in plain sight. Watch our next video. Beware of these 8 silent bone cancer symptoms. Could save your life, because these warning signs are so subtle, even doctors miss them. Don't let these kidney stone symptoms become your biggest regret. Your body is always warning you. The question is, are you listening?